Thank you very much, Doug, and welcome to our panel today, everyone. I'm coming to you from the land of the Yagara and Turrbal people. I'm Jane Britt, as Doug just mentioned, Policy and Advocacy Team Leader at Blind Citizens Australia. Recent years have seen devastating national emergencies. In late 2019 to the present time, in 2022, Australians have experienced the Black Summer bushfires, the national health emergency of the COVID-19 pandemic, and catastrophic flooding across the eastern seaboard. All emergencies have led to loss of life, loss of properties, and with COVID-19, an emerging new cohort of people experiencing chronic health issues and chronic fatigue. The time has never been more critical to take the lessons learnt and translate them into measures which ensure we are all prepared for emergencies. A La Niña event has been forecast for Australia for the third time in 3 years, a climate phase which increases the likelihood of significant rainfall and therefore flooding. Today, we have experts here to discuss preparing for emergencies and response during those emergencies for people with disabilities and for people who are blind or vision impaired. Blind Citizens Australia has been involved in direct response and input across states, territories, and in national forums about lessons we have learnt from direct input from our members. We have provided our expertise in making recommendations for future emergency events. BCA has also made submissions to the Disability Royal Commission and to the Senate Select Committee about COVID-19. In addition to this, we will be working with the National Policy Council towards creating a policy in this area. Today, BCA would like to extend what we have learnt from consultations and community forums to invite our expert panel to provide us with their insights from their work in this field and their tips and advice for being prepared for emergencies. We are joined today by Kate Faith, Senior Firefighter, Community Engagement Unit with Fire and Rescue New South Wales, Michelle Villaneuve, Deputy Director, Centre for Disability Research and Policy and Associate Professor at the University of Sydney, and Melissa Fox, Chief Executive Officer at Health Consumers Queensland. Kate, Michelle and Melissa, welcome and thank you for joining us here today. I'd like to first open up to speak to you, Kate, about how did you come to work for Fire and Rescue New South Wales, and can you also bust a myth? I was interested to learn when we were preparing for this panel that the work of yourself and your organisation extends to beyond just attending to fires. So what other work do you do?
Thanks for having me, Jane, and I'm coming from the land of the Darrawa people that I'd like to acknowledge here in Sydney on Botany Bay. So look, I became a firefighter 6 years ago because I like to help people. And, you know, I've gone from fighting house fires where you get to make the worst day of someone's life a little bit better, or from attending car crashes when, again, the worst day of someone's life, you can assist and make them feel calm while you assist to get them out of the wreckage. And I've now moved into the community engagement unit because I can see that I can help more people on a bigger scale via the project work we're doing. We've actually got some amazing work happening in the disability space, which has been a long time coming. And I look forward to rolling that out over the future months and informing everyone as that gets done. But yes, we do a lot more than fires. So we assist the RFS with bushfires, of course, in their areas. We deal with motor vehicle crashes. We make hazardous chemicals safe. So when there's a large spill, that can even include, you know, self-harm incidents that we attend. We assist ambulance as well, and we'll begin CPR until the ambulance gets there if we get there first. And that may include handling patients that may need assistance to be brought out of buildings that the ambulance needs a hand with as well. We also assist with counter-terrorism measures. We have swift water rescue people. We have USAR people that work overseas during humanitarian crisis. So there's a lot that we do that is more than just fire. Fire is actually one of the smallest things we attend now.
Yeah, so that your role is incredibly diverse, and also the role of your organisation. We'll hear a little bit more from you later about lessons that you've learned throughout your work and what our members can learn. But Michelle, I'd like to bring you into the conversation. We became connected to each other through your work on disability inclusive disaster risk reduction with Queenslanders with Disability Network, and particularly through the COVID-19 pandemic and flooding emergencies. I'd love for you to talk a little bit to our members about your work about person-centred emergency preparedness for people with disabilities. What does person-centred emergency preparedness mean, and what does your research aim to do?
Thanks so much, Jane. I really appreciate the opportunity to be here. I'm calling in from not my homeland, but I'm on Turrbal and Jagera lands today. So I'd like to acknowledge the traditional owners here. I've been up in Brisbane because we're heading next week into the Asia Pacific Ministerial Meeting on Disaster Risk Reduction. And it'll be a great opportunity to spend the week promoting disability inclusion in that space. So where to begin the story, Jane, on person-centered emergency preparedness? I think to start at the beginning might be helpful to help folks understand why we have this suite now of tools called person-centered emergency preparedness. We started working in Australia, in New South Wales, in about 2015 on this issue of disability inclusion and disaster risk reduction. And we had these, 4 principles about how to do it: participation, collaboration, non-discrimination, and accessibility. But we didn't have any how-to guide about how to implement that in practice. And so that was true for the disability sector, who hasn't really been actively engaged in emergency preparedness planning and disaster risk reduction activities in their communities, but was also true for the disaster management side of Australia's, protocols and emergency management arrangements. They had really there was no disability inclusion mentioned or considered in those emergency management arrangements. So we started where it made sense to start, which was to bring emergency managers and emergency services personnel together with people with different function-based support needs that they have to manage and cope with every day, to talk about what are the risks for people in emergencies and what can be a better response to make sure that people with different functional support needs are safe, well, and mostly prepared well in advance of a disaster. And that was a really interesting project because we came out with local emergency management guidelines in New South Wales to help promote disability inclusion across that sector. It was really designed to be used by emergency managers and councils and planners. And those people who go out and do community engagement and help us all be aware and better prepared. But we also created a problem for ourselves and for the sector. The problem we created was one of the key recommendations was that people with disability and who have different function-based support needs in their lives and who might have extra support needs in emergency situations, they need a tailored approach to emergency preparedness planning. And that tailored approach to self-assessing your risks and tailoring emergency preparedness to your support needs did not exist. And so we set about a journey of working in partnership with our emergency services colleagues and government colleagues, with people with disability and their representatives, and with the services that provide supports to people with disability in the community. And over time, we have emerged together through lots of co-design and field testing and trials, and now a real full expansion of the person-centered emergency preparedness toolkit. So what is it? It's a guide to help people tailor preparedness to their support needs. Oh, sorry.
No, I think someone just accidentally became unmuted.
Oh.
You can continue.
Sure.
What exactly that means? Yeah.
Oh yeah, I was just finishing that point. That what is person-centered emergency preparedness? It's really a self-assessment tool that helps you to really self-assess what are my support needs and capabilities in everyday life. It helps people to learn about and personalize the risk situation where they live, work, and play, and then use that self-assessment and understanding of disaster risk to tailor preparedness to their extra support needs. And the fourth part of the PSEP toolkit is a really critical part, because some people will still have extra support needs that can't be met after they've made that tailored plan. And so that is really all about working back in partnership with emergency services and governments who make community level plans to keep us all safe. And those community level plans are now about responding to those extra support needs and increasing and improving how government plans for their whole community, including people with disability.
Yeah, so I guess Kate, your role at the moment is about responding on the ground as a first responders, response to emergencies, and then the work that you are doing, Michelle, is sort of focusing on the response that people have, and then working out how to prepare before it happens, and then how to assess things after it happens about what to make improvements with. Melissa, I'd like to bring you into the conversation. So Melissa and I became connected to each other through the Queensland response in the pandemic. And we have been in a group of consumers, clinicians and community members working on pandemic measures and response, including for people with disabilities. Melissa, how has Health Consumers Queensland been involved in the response for health emergencies for people with disabilities, particularly in the past few years, given your role is to support the consumer voice in ensuring a safe and quality healthcare system?
Thanks, Jane. And it's a pleasure to be here today. I too am on the Yuggera and Turrbal people's lands. I'm in Kurilpa in Meanjin, and I pay my respects to elders past, present and emerging. And it's a delight to talk about this because working with yourself and BCA and all of the many other consumer, community and professional orgs has just really been what's kept me going through this marathon that I don't think any of us expected to be at the centre of, and I know I'll talk about that a little bit later, but the way we became involved was we have been around since 2008, and there's equivalents in all the other states and territories, and really our organisations primarily have been based on supporting hospital and health services, otherwise known as local health areas, and state health departments, different providers and universities to create person-centred health services, so co-design and consumer engagement. But when the pandemic hit, we were quite shocked at the very fast shift to central command and control around the pandemic response, around the health systems response, and around decision making. And it was not what we were used to. So as an organisation, we quickly shifted to creating some online mechanisms to hear from people with chronic conditions, people with a disability, people living rurally and remotely, carers, First Nations people, about what was and wasn't meeting their needs during the pandemic. And we were fortunate at that time to have leadership up here within Queensland Health who were grateful at being reminded about the way that we were used to working together in partnership, and brought us back into the fold to help shape comms and models of care, but it's been a bit of a hard slog, as I'm sure we'll get into. Lots of fantastic impacts, but also lots of challenges.
Yeah, it's been a very fluid environment for the last few years, and I think that it's been a real groundswell of discussion in this space and around what needs to be there in terms of the response for people with disabilities. But one of the things that came up, and Michelle, I'd love to throw back to you here about with the pandemic, in the early stages especially, and also in response to the bushfires, we heard from our members quite strongly that there was a need for better communication response in disasters, and especially that accessibility of communications and real-time access to emergency information was problematic. What have you found in your research to be important in terms of communication before, during and after disasters?
Yeah, and maybe if I can take some liberties, Jane, to expand that to think about some of the other key elements that we think are really critical to pre-planning before, during, and after disaster. But I'll come back to communication because it's always where the rubber hits the road, is with communication of those warnings in emergencies. But I've talked so far about the person-centered emergency preparedness toolkit, but maybe I'll just describe the framework of which communication is central. It's one among 8 different function-based elements that we have put into the PSEP framework to help people start where they like with each of these elements, look at what applies to them in their everyday lives, and look at what kinds of extra supports they might have in an emergency as a starting point for thinking about what the risks are going to be when disasters strike. So the three that are at the top of our capability wheel are living situation, social connectedness, and transportation. The reason those three are kind of along the top is because they apply to everybody, disabled or not, function-based support needs or not, chronic health conditions or not. We all have to think about our living situation. Transportation in particular, if we need to evacuate and we don't have access to a vehicle to evacuate. And also, if we're sheltering in place, how are we going to get access to services and supports that we need, often relying on transportation? And of course, the social connectedness, we know your first responder is the person standing right next to you when a disaster strikes. So knowing who's in your support network and knowing how ready you have access to them becomes pretty critical. And we might want to come back to that idea of social connectedness when we think about communication. So then there are 4 other elements that we have put into our person-centered framework. And that's because this now blends the research on disaster risk reduction for everyone with disaster risk reduction for the additional and extra support needs that people with disability might have. And those are assistance animals, pets, and companion animals, communication, personal support, management of health, and assistive technology. So thinking of all of these elements collectively, some will apply more or less to each of us, but they really help us to begin to break down that pre-thinking and planning process. Now, if we go to your question about communication, that one is kind of twofold. For people who get, give, receive, or understand information differently, including using technology or with support of other people, then that becomes an additional extra support need that people have to access mainstream information before, during, and after a disaster. And I think what we're finding is we've seen some improvements. COVID and COVID announcements through media started to put Auslan interpreters front and center, but I think didn't necessarily consider other ways of getting, giving, and receiving and communicating information. And so we still need to think about what are the best ways for people to access that information about risks and the development of warnings over time. The other thing about the communication is it's about, what's going on in the emergency event and how do we get that trusted information? But it's also about who do I trust to get that information from? And so what we're finding in our research with folks in the community is that people will access their trusted people and sources of support for information. So pre-planning how they're going to get that information well in advance of a disaster is an important part of the person-centered planning process. And I suppose the last thing I might add to this part of the discussion, Jane, is this idea that if we kind of haven't pre-planned for all those additional things we might need support with, when a disaster strikes is a little bit too late to kind of gain our composure and try to figure out how we're going to do that. We're all quite stressed in that moment. So that's when, our cognitive capacity shuts down a little bit more and our communication skills probably deteriorate a little bit more, and our ability to sort of effectively use information becomes challenging. So pre-thinking how we're going to give, and access information for emergencies would be really helpful if people had a plan for how they would do that well in advance.
Yeah, and I think that's something that, throughout consultations I've been involved in this space that has come through quite strongly that, as you say, when you are flustered and you are trying to deal with an emergency in real time as it's happening, it's much harder to think straight and be, proactive in making the decisions that you have to make to keep yourself safe. Kate, I'd love to know what your best advice would be for preparing for an emergency. Michelle just touched on the 3 top things there of living situation, transport, and communication being 3 key factors to think about. Where does your work fit into this, and what you've learnt about what people should, think about when they're preparing for an emergency?
So the most important thing, let's break it down into two different circumstances here. So we've got bushfire, the disaster, where you'll generally have some time to plan, to evacuate, to enact your PSEP plan, as Michelle mentioned. And in that instance, it's always best to act as early as you can so that you don't get stuck in a situation where all of a sudden things become time pressured, and you start to rush through and then possibly leave things behind or don't get things as organised as well as you could. When you're living in a bushfire prone area, such as an urban interface, so that is your house backing onto the bush, RFS will offer a free service called ADA, where they can come around, clean your gutters out, trim back any trees, and these are all key things to preparing your house for bushfire season. So you don't want any loose leaf littering gutters, no trees coming across the house. Make sure all dead debris is removed from around the house, lawns mowed, no piles of wood or other chemicals stockpiled up against the house as well. So they're your really easy key things you can get done, and RFS does offer that as a free once-off service. Now, it's a little bit different when we come to talking about house fires, because house fires are a time-critical situation. So it takes about 3 minutes for an entire room to be engulfed by fire, and only about 2 breaths of toxic smoke to become unconscious. The biggest thing you can do to prepare yourself for the event of a fire in your house is to practice. Practice what you're going to do to get out of that house, because it's dark, it's disorientating, especially at night time. You'll have to get down on the ground and find your way out through the house that way, which probably is something you're not familiar with doing. I would say most of us aren't familiar with crawling around our own houses to find what that feels like. I, as a firefighter, have to do that on a regular basis because we are essentially without sight when we go into a fire, and we use what's called a left hand or a right hand search to stick against the wall so that we don't become disorientated as we work our way through the property. So I would suggest that's one really good technique everyone can learn and practice with, and make sure you're looking at 2 ways of escaping each room as well, because you may have one way that is blocked off and you might have to choose that second option. There's also a few other good little tips that I've been learning along the way consulting with groups. If you've got a guide dog and you've only got one harness, keep a leash at the spare door. So that way, if you've got some kind of constraint as you're exiting the house, potentially consider packing an emergency bag somewhere near the exit too for your guide dog. Making sure that when you call, if you're the one to call 000, and I always do this when you're outside of the house, once you've escaped, let the emergency services know if you have any additional needs so that they can act appropriately when they get there. Let them know if you've got a guide dog. Maybe the guide dog didn't come out with you and they know that they've got to go in and get that really valuable resource for you. A lot of people don't actually think that telling us will change the situation, but it allows us to think about how we're going to respond as we're driving along in the truck to that incident. So it's a really helpful piece of advice. Other than that, I would say your biggest thing that you've got to have in your house, your smoke alarm. And it's not working just because it's up on the roof. It's got a big button underneath it that can be tested with a broomstick, or you can have someone else test it. I recommend too, if you've got low vision, putting a big coloured sticker on the bottom can help you test it with the broomstick. If that sounds, it's working, it's fine. If it doesn't sound, it's no longer working, and they shouldn't be older than 10 years old also. So that is the only thing that's going to wake you up in the middle of the night if a fire does occur, because smoke actually puts you further to sleep and you can't smell it. Now, Fire and Rescue New South Wales offer a free service called Safety Visits, where you can call your local fire station. They're happy to come around to your house to test your smoke alarm for you. They will also replace it for free and install any additional ones if necessary. And they can also walk through your house with you and give you some general fire safety advice based on your living situation. So that's something our firefighters are actually going through training with at the moment. We've created a toolkit for people who are blind and have low vision so that our firefighters can be adequately trained to go visit your houses in the future.
That's fantastic to hear. And I should add there that with some of the resources and things that are being mentioned today, we will make sure that information about that is available to all members, both here today as well as maybe listening to this after it's happened. I would love to talk a bit about the resources that you have been talking about throughout this session. So Michelle, you've helped create the toolkit that's been referenced quite a few times, and Kate, you're working on an app, and Melissa, I know that Health Consumers Queensland has developed a number of resources. Michelle, I'll start with you. Can you talk a little bit about that toolkit and how that members might be able to use it to help them prepare ahead of any emergency?
Yeah, the toolkit actually is available on our website. So I'm glad to hear that you'll be able to share those details later. It's collaborating4inclusion.org. And if you follow the links, a number of links will take you to the PSEP resources. But the best way to probably approach that toolkit is to either download the toolkit or work together in conversation with someone who has downloaded it for you. The toolkit is actually meant to be a conversation guide. It's really not designed for you to read through and, prepare an emergency plan all in one go. It's really designed to start a conversation and persist with continuing some of those hard conversations about support needs in emergencies, but also recognize strengths and capabilities in that process. So one of the best parts of the toolkit is our capability wheel. And I'm pretty excited to share with this group that we are now in the process of having all of these resources audio recorded, and which will be available beyond just the screen reader enabled access to these resources, which is a pretty exciting development in the toolkit. And I think I should also say that our toolkits, because we are constantly testing them with different people to see how it supports them to make a plan, we constantly grow the toolkit and develop some stories and illustrative examples of how other people have prepared. And so when people visit the website, they can expect that it will kind of change and develop over time as we gather more stories and examples coming from, the voice and perspective of people themselves. But the person-centered emergency preparedness workbook is already full of those examples, tips and tricks for every element of the PSEP framework, both at the self-assessment stage of how do you manage every day, but also in the tailored emergency preparedness stage of how do I now fit emergency planning to my particular support needs and my particular situation. And that's probably the most critical part of the self-assessment tool and process. The website is full of videos. So we have tried to make the information accessible to people as possible by being able to listen to information about the toolkit, hear from the voice and perspective of other people who've put it into action. So feel free to have a look at those resources. And I will make an open call and plea and request to BCA to say, if you have advice and suggestions about how we can make these tools more accessible, please do not hesitate to get in contact with us, give us advice. We see this as development in process and an important conversation and dialogue that we need to have with people using the toolkits. So we would love for more people who are blind or have low vision to try the tools out and give us advice on the other ways that might help you to access the information, and also maybe to share stories of your tips and tricks for how you got your plan together.
Yeah, thank you very much for that open offer, Michelle. I think certainly we'll be engaging in that conversation as we go along, and certainly how the resources can be, developed as we go into the future, and for our membership to be able to use them and benefit from the work that you are doing in this space. I'd love to throw to you, Kate, about the app that you are working on called Ember app, one word, with the Flagstaff group that assist individuals living with disability to prepare for bushfires and other natural disasters. Can you share some more information about what it is and how it can be used?
Yep, so as you mentioned, the app was developed by Flagstaff through a grant, and it's a fantastic tool that basically allows you to put what Michelle is talking about as your PSEP plan into a very simple format that you can keep on your phone to have a quick reference at any time. It's got some fantastic tools in it as well, such as soundboards for people who are non-verbal. The kit came with Braille cards as well, and an emergency backpack for members down in that local area around the Illawarra. The app is available for anyone to download, and you can also pre-fill all your emergency information in there also, so you've got it on hand at any time. I highly recommend you take a look at that, because it's just another part of your toolkit that you can have to make things easier in the time of a disaster. And I believe there's an update coming out shortly which will address accessibility for people who are blind or have low vision as well, to enhance that experience.
Yeah, excellent. Thank you very much for sharing that with us, and also introducing us to the app and the work that you're doing. Melissa, I'd love to know, I know that Health Consumers Queensland has developed resources over time that have been put out about different things to do with health consumers, and ensuring that the health consumer voice is at the centre of healthcare. What tips do you have for people with disabilities in the self-advocacy for health emergency situations, from what you have learnt throughout time, and especially through what you've worked with throughout the COVID-19 emergency?
Yeah, absolutely. And so this ties back to when you referred to us as the panel as experts. I felt deeply uncomfortable about that because, what I've always believed to be true and seen, and especially in the area that we're talking about, every individual is the expert in their lives. And I think the opportunity to pre-plan for access to services and the supports that each individual needs is really at the heart of good emergency planning. And so our sister organisation, Queenslanders with Disability, I believe partnered with you, Michelle, had the emergency preparedness tool available on the Queensland Health website for people with a disability to be able to use to pre-plan what they needed. The other piece that I would say as well is if people do hit barriers, to absolutely reach out to advocacy organisations, and it's been great the opportunity that we've had for you to share what advocacy your organisation has been doing, and then for us to amplify that at the state and national level. And quite a lot of those barriers to care and issues that have been resolved have come from one or several individuals sharing their experience with yourself or with us. So the power of a voice is something not to be discounted, and I think partnering with health professionals as well. So whether it's an individual practitioner or with professional organisations, we've had great success in doing joint advocacy campaigns between organisations such as ourselves and all of the GP peak groups, the pharmacy peaks and the Nurses and Midwives Union up here, including to raise the profile and demand a better system response across government for the health needs of people with a disability throughout this time. And now that's continuing on. A working group that was set up around that is continuing as the Health and Disability Interface Advisory Group, and I'm sure that emergency preparedness and response planning will continue to be a part of that.
Yeah, and I really love what you just said about the experts. That certainly we have a room full of experts today as well, in your own lives and also in your own responses and experiences that you've had with natural disasters and emergencies of in your own lives. I know earlier this morning when we had the preemptive interview before this entire Connect kicked off, we heard from one of our members about their experiences of being involved in the 2011 floods in southeast Queensland. So I guess, at this point, I'd love for any of you to jump in and also to respond to each other. I know there's, a lot of similarity in the things that you have spoken about today. Of any practical tips or tricks that you haven't had the chance to speak about yet that you really want to, impart to our members as something of importance that they can think about when preparing for these things?
Can I say something? I'm Nidhi Shakaran from Sydney, BCA.
Yeah, sure. We'll start taking some questions then from members. Yeah, thank you, Nidhi. Yeah.
I was involved in the emergency preparedness session from Fire and Rescue New South Wales beforehand with Kathy Feller from Vision Australia. And that was for people with low vision in the past. And I also was involved in emergency preparedness sessions from another organisation that I worked with an emergency plan for people with mobility disability, because I have got cerebral palsy as well. And they told me to actually walk the emergency route, and also find out about how much you practice how much you can bend and how much you can stretch in an emergency to exit out and stuff, and know how to lock doors, how to lock windows, how to open windows and stuff like that beforehand.
Yeah, thank you, Nidhi, for sharing that experience. Yeah, thank you.
I actually remember Nidhi being in one of the focus groups we conducted through BCA, I think it was last year now, in our preparation of updating our accessible information. And just to add to what she said there, we highly recommend that you keep your keys in your locks at home so that you can always access them quickly in a dangerous situation. You don't want to be rummaging around trying to find where that set of keys are when you just have to get out of the house. So, and once you're out of the house too, so if you can make friends with your neighbours, if they're nice people to talk to, just try and have that relationship there, because you're not always going to have a phone when you get out of your house as well. So if you have people around you in your street that you know and trust, really useful tool as well.
Yeah, I think that's really great advice, Kate. I know it's something that I've done, and I don't know if this helps any of the members here today, is that every night before I go to bed, I go around the house and look at where the keys are. So I know exactly that I placed them in the right spot and have remembered to return them if I haven't to that spot. All right. Can I ask who has their hands up, please? Can someone let me know?
Yes, Jane, it's Naomi. And
Yes.
The first question comes from Christy.
Christy, thank you.
That's okay. It's not sorry, I've got a comment more than a question.
Sure.
In parts of where I live in Tasmania, there's not much or no mobile phone service or hardly any internet, or people have trouble with it. One comment I would make is if there's a way of people finding out, like making phone calls or whatever, to let people know of any evacuations or anything, because we had no power here for 8 days one time, and it was good that we had some mobile phone service, but for people who don't, it would have made it a lot difficult if they didn't have internet as well.
Yeah, I can understand that. Do any of the panel want to respond to that?
Oh, sorry, Jane, it's Michelle here. But I just heard, was that Kate that was going to jump in?
That's all right. You go first, Michelle.
Oh, well, I was just going to say that, Naomi, you have, or sorry, who was that was just speaking?
Christy.
Sorry, Christy. Yes. You've raised a really, really tricky issue that is really problematic for some areas across Australia that already have shaky internet access in the best of times, let alone during times of disaster or when the power goes out. And this is something quite critical that councils, I know, are reflecting on deeply about how to improve their access to communities, particularly when people get isolated in their community, away from other people and behind perhaps a flood line or even a fire line when these disasters strike. So I think one of the things that is really coming out of those discussions is the absolute importance of knowing your neighbors and having a local, real connected group with a bit of a community level plan for communication and information sharing, because I think that can be a really important strategy for accessing information and working together to keep each other safe when you are isolated from information. Over to you, Kate.
And it's Kate here, Christy. Yep, Michelle pretty much covered off what I was going to say, but just as another practical note, keeping a battery powered radio on hand is a really good idea. You'll still get a lot of the emergency channels coming through, so always keep one of those in your emergency grab bag. Pardon me.
Yeah, thank you for those tips, Michelle and Kate. Naomi, do we have some more hands?
We certainly do. We have lots of hands. The next
Great.
person wanting to question or comment is someone who's identified as big iPad.
That's me. It's Sally. Right, and I see this at work as well. We're very good at looking at preparing for emergencies, but there's coming out of significant weather or primarily weather events is what I'm thinking about. It's also allowing for that to happen. I live in Darwin. Cyclone Marcus took the power out. Some people where I live, we had underground power, so we were right. Somebody I know was out for 2 weeks. But trees were down for about a month afterwards. So that they'd cleared the roads, but some of the pathways were still had piles of trees waiting to be removed. So I suppose that's probably the next thing to look at once we've worked out going into the emergencies and people preparing. How do people who have still got the same issues going into the emergency, how in the recovery phase, that's probably the next area that needs to be looked at. Is there anything going on in that sphere?
Do any of you want to respond to that?
I'm happy to chime in, and Sally, to reiterate, yes, this is a pretty significant issue for people who are blind or low vision navigating around through communities after some of these events, big storms and so on, is problematic. If I can suggest, the biggest voice that you have is through your local council. Where you live, work and play, I would suggest getting in contact with both the emergency management planner side of council and also the disability inclusion access side of council, and have a conversation with them about your worries and concerns about this after storm and get access to information about that. I think you will find that councils are quite responsive when they can understand what the situation is for people. While they may not be able to fix the problem immediately, and they may have to wait for volunteers or emergency services to help with some of that support, they certainly can support communication about timing. And I think that's almost as important as knowing that it's cleared and it's safe for me to wander through the community, but also having some communication and being able to anticipate when that will happen, so that you can plan to be perhaps isolated a bit longer than expected in your own home.
Yeah, that's probably the thing, that because everybody was very talkative. You just talked to random strangers over a tree, and I think I climbed over 3 low trees, and somebody pulled over and said, "Oh, do you need a hand?" I said, "Hang on, I've just climbed over 3 trees and there's nothing in front of me." So people in the community are very helpful. And I think probably the fact that we're right on the opposite side of the country apart from Perth, away from major population centres, it's getting the resources and just trying to get that communication and going, that sort of thing.
Yeah, and Sally, these are good conversations for me to hear as well, because we have lots of interactions with the government stakeholders and advising them on what can happen. So rest assured, these are really good examples for me to also take forward in our work. And I know that in Northern Territories, there's sort of fewer policies and fewer documents, and we're actually reviewing those right now. So I guess as we pull that together, BCA might be interested in some of the results of that parts of our research. So I'll make sure to keep you guys informed of how we're progressing with some of that work with council and council level planning.
Yeah, thank you, Michelle. We'd be very interested in hearing more about that and also sharing that with our membership. Naomi, do we have more hands?
We do. Our next question or comment comes from Susan Thompson.
Susan, you can unmute. Yeah, excellent.
Okay, sorry. Look, I was going to ask one question before, but now I've actually got another one instead of. And that is going to this fraught issue of a register and identifying as someone with a disability, with needs, etc. One thing that occurs to me by way of a potential long-term solution might be, because I personally think some kind of a register is a good idea, but there's always issues of updating and this whole, issue of self-identification and opting in and opting out and all that kind of thing. But it occurs to me that one possible solution might be for somebody to set up a profile on some kind of a system that generates an ID number, like a Medicare number or whatever, that then they can quote as, hey, I've got one of these numbers and I'm in need, to whatever the emergency responder is. It's just a thought that I was having while we've been talking about this, because it's something that's never got resolved. Thanks.
Yeah, Susan, I think it's something really pertinent that you raised there. Michelle, Kate, or Melissa, do any of you have a response around this? And is there any work that's been done in this space in recent times?
There's always a lot of talk about this, and as you mentioned, Susan, it's the problem of updating these registers that can be quite a bugbear, and not only poses risks that we might be going to the wrong house for someone, etc., but also for the people that are sent out to rescue certain people. If they're people that have moved on, there might be no one living in that house, there might be someone who's already evacuated in that house. We're then putting our emergency responders at risk. I think the idea of the ID number is quite good, and we're actually considering for our safety visits to have the fire station, when you call them up for a safety visit, quote you a number that you can ask for at your front door to ensure that it's us showing up and not someone else. That was something that came out of the focus group. So I think that's really good. And look, also
I think my idea though was more about, and I absolutely agree with you about the register updating, etc. Whereas if it was up to the person to quote their registration ID as they were calling for help, I know there are all kinds of different scenarios, but this is just one. Then that would then be upon them to make sure it is up to date.
Yeah, absolutely. And we continuously look at how we can do that. But in the meantime, my biggest suggestion is get to know your emergency services in your local area. No matter where you live in Australia, most of the fire services are willing to come out and give you some assistance to help you prepare. And that way you get to know who your local fire services are, and they get to know the local people in their community that may require some extra assistance, and to check on them every now and again and make sure they're all right. So just as an interim step, I'd say that's a really good way of moving forward in the meantime.
Yeah, thank you, Kate. And Michelle, I think you did unmute briefly then as well. Did you have something to add to that?
I think Kate has really covered it off. And,
okay.
And Susan, I do believe that I think you're right. There's probably a place for a register, but unfortunately, there's too many challenges at the moment. One thing we are working toward, though, is looking at how can we find a more effective way to collect that data about extra support needs of people. And this is where the PSEP comes in again. So we can actually have a common language between councils, emergency planning, emergency services, and people themselves. So we can start to get a more effective understanding of what are those support needs, who has those support needs, and where are they, stripping our individual capacity to respond. I'm afraid that is still a work in progress. So I really appreciate the comment and recognition of how challenging that space is around registers.
Thank you, Michelle. Naomi, another
Yes,
hand?
It certainly is. Next question comment comes from Angela on behalf of somebody.
Thanks, Naomi. So Doug has emailed through to bca@bca.org.au asking about audio description of emergency announcements and media press announcements. So it was mentioned, I think, by Melissa earlier around the necessity of having Auslan interpreters, and that did happen in terms of the COVID response. But just, adding to that in terms of accessibility, to make sure that all visual messages and all text on TV screens especially are audio described, just to make that message more accessible for a broader population as well. So I don't know if that's a question or more of a comment, but yeah, BCA is also happy to provide some further information and resources to make that happen if required, and also in some of those resources in the session too, very happy to you know, to make sure to do some testing and some give advice to make sure that that is accessible for people who are blind or vision impaired as well.
Yeah,
Thank
that's
you, Angela. Yeah,
a very
sorry,
important,
Kate.
very important point, Doug. And that came up again in the focus groups that we did with BCA last year, that during the bushfires, you know, when heat maps were shown on TV, the ticker rule of information down the bottom, there was so much information that they weren't able to access. I have actually raised that through one of my
contents insurance.
Oh, Jeremy, I think you just unmuted briefly, but yes, Kate, continue.
And so I've had my big boss at work. I had some conversations with him, and he's actually raised that with the Emergency Communication Council of Australia. So I can follow up on that further to see what space they're in, because most of the time they need a little bit of a push along with these things that they sometimes put in the too hard basket, but more and more there's more focus on it. So it's a good time to raise it again.
Now is also a good time with the Australian emergency, the new Australia warning systems that are coming out. This is a great time for BCA to advocate for accessible communications around the new warning systems too.
Fantastic. It's certainly something that we will follow up and ensure that we engage with the development of that. I think we have time for one more question before we finish up the panel today. But if there were any extra questions that anyone had, you certainly can email us at any time and we will make sure we follow up. Naomi, is there a final hand for us?
Certainly is. Adrian Watson.
Hello, it's Adrian here. Just a couple of things. I went through Cyclone Debbie when I moved to Mackay about 6 years ago. And what I noticed as a blind person was a lack of communication. If I didn't have my Telstra mobile, I wouldn't have got any signal for at least 5 days, 6 days. And as a pension, you run on pension to pension with your food money. And I agree with what you're saying, having a little bag and stuff with essential stuff on it. But the lack of communication from the Mackay Council through the radio, I found very frustrating. They had a beautiful website, but no good if you've got no communication. And now I've moved down into Victoria. We don't have, we have a local ambulance, but the nearest hospital is 50 k's away. And if you get a strong windstorm, it'll knock you out for that day. As a blind person, how do I know to get around anywhere when it's not being publicly advertised in the local town of Glen Thompson? And I feel that maybe need to be pushed for a lot of people who, especially a town like Glen Thompson, there's a lot of older people. Maybe this is something the emergency services could look into to get more awareness out to people who are in these old, you know, in these remote communities or stuff like that. And especially when I was in Mackay, I like the idea of the registration kind of thing beforehand to say, look, I've got a person with a blind person, so you know that someone's there. Even if they disappear, at least you know they've been registered there, that they've been checked up, they're okay. Where I wasn't even checked out for 6 days on what was going on. Fortunately, I had my phone connected to Telstra and I was able to talk to family. But my battery was dying pretty quick. It didn't last long because there's no power. So it was a lesson for me to stock up on food and to be prepared to evacuate if you have to.
Yeah, thank you, Adrian. I think, you know, that you've touched on some really important points there. And I think, Michelle, I'll just go to you briefly and then we'll wrap up today's session.
Yeah, and Adrian, I just wanted to reinforce that your experience is a really common one we hear in our research where people say nobody checked on me. And I think that's, I just want to acknowledge that must be really hard and something that we really need to think about. And I think our member organizations like BCA, maybe other memberships and groups that we work with is a great opportunity for us to talk about emergency preparedness and make that kind of networked communication so that we have the people we already trust and rely on as people that will both check on us and that we might reach out to check on other people when those disasters happen. And I just wanted to pick up on one more thing. Across Australia, disaster dashboards are being the go-to rollout among most councils for communication. So here's another advocacy opportunity for BCA. How accessible is the information, which is highly visual information? How is that accessible to people who are blind or have low vision? So I think that would be a great area for future advocacy too.
Yeah, thank you, Michelle. And I think, you know, coming out of this session, we have a few different advocacy opportunities that we will be taking up, as well as I think today we've heard a number of tips and advice from all of you that have been fantastic. Far too much to summarise at this point, but we'd like to say that we will put that together as resources for everyone who is here today, as well as anyone who's listening to this later, that we will get the names of those services written down, the safety visit, the AIDA service, the Ember app, and the person-centered emergency toolkit that will make sure that you all have information about. I'd like to finish today by thanking very, very much Kate, Michelle and Melissa for joining us. It's been a really interesting discussion, and I know that we could talk for much longer on this, but there is some other sessions today. So I'd just like to finish up by saying thank you very much for your time and for sharing your expertise with our members today.
Thanks so much, Jane.
Pleasure. Thank you. Enjoy the rest of your day, everyone.
Thank you.